I'm a clinical pharmacist with Shields Health Solutions. And what we do at Shields is we partner with health system specialty pharmacies to provide care for their patients. I have a certified specialty pharmacist certification as well. And I primarily work in oncology and hematology in my clinic. So pretty much 100% focus on oncology and hematology for my patients that are programs such as side effect management, patient counseling, adherence monitoring, those types of things, adjustments in terms of patients' medication regimens. And we do service patients who have rare cancers as well. This paper was published in the Journal of the American Cancer Society. And what it studied was projected cancer rates for patients by the year 2050. And really, some alarming numbers came out from this, where they projected that overall cancer rates in 30 different types of cancers, specifically in men, are expected to increase from around 10.3 million in 2023 to up to over 19 million in 2050. So this is an increase of 84% in cancer cases that are going to be diagnosed. And then also they saw a rise from 5.4 million to 10.5 million, which is a 93% increase. So those numbers are a little bit scary. They're a little bit alarming to know that, hey, we're almost going to double cancer cases and also cancer deaths by the year 2050. However, a lot of those stem from population increases and also increasing age as we move along too. So there's a call for a couple different things from this study, and that being a stronger healthcare access, stronger healthcare infrastructure, things that can help patients to mitigate and combat the higher rising cancer rates that we see, that we are going to see and project in patients. So there's a couple different factors. They break it down into sort of socioeconomic groups. They break it down in terms of rare cancers. Things like rare cancers have higher mortality to incidence ratios, specifically pancreatic cancer being a rare form of cancer. That has a 91% mortality to incidence ratio. And then men are more likely to have those kind of modifiable risk factors, exposed to carcinogens in the workplace, less likely to access screening programs. So this study was focused on men and those increases in cancer rates by the year 2050. No pediatrics were studied in this study. They did base it on age here. They have working age men aged 19 to 64. And then they kind of broke it down further into men over the age of 65. Men over the age of 65 did have higher cases and higher deaths, up to 117% in patients over the age of 65, but no focus on pediatrics here. The age groups that they kind of subcategorized here were the working age groups, which had an increase of, or do have an increase in cases of 39% versus the 117% for older aged men over the age of 65. It's, like I said, alarming in terms of seeing, 84% increases in cases, 93% cases and percent increase in deaths. So what that means is that we're going to need to build a infrastructure. We're going to need to start to train more oncologists, more pharmacists, more nurses, navigation. We're going to have to implement more health system programs. We're going to have to expand hospital access. We're going to have to expand medication access as well. So in terms of treating rare cancers, a lot of those therapies are novel, they're high cost, they're hard to get. There's practices and protocols and parameters and guidelines in place to even be able to distribute these medications. So a collaborative effort between places like specialty pharmacies is going to be important as we go forward. So specialty pharmacies have the ability to access these medications, put these practices, parameters, and protocols into place. And health systems are leaning more on these specialty pharmacies to have higher medication access, right? To follow through with these parameters that are set forth by either the manufacturers or the FDA guidelines. So we have to invest in research. We have to invest in innovation as we go forward. train, like I said, more staff and more personnel, because this is going to put a high burden on the healthcare system. From 2020 to 2050, it's expected to the cost of cancer care is expected to be around like 25 trillion. And this puts that, like I said, a high burden on the healthcare systems here. So expanding the access that patients can have, expanding the training for professionals as we go forward is going to be important as we mitigate and combat the rises in cancer rates. In the past decade, 10, 15 years, there's been a monumental shift in especially something like specialty pharmacy, where a lot of cancer as well as rare cancer treatments have come. In the early days, we didn't have places like specialty pharmacies where you could get access to these treatments. And now that's evolved a lot, where every health system has a specialty pharmacy that they go to. So that will continue, in my opinion, in terms of how we have these expected rises. And it will continue to expand and grow as we move along. This study is a call to action, right, to improve that healthcare infrastructure. So hopefully, things like this study will kind of alert those clinical stakeholders, those health system stakeholders, to start to invest more in their health systems, expand treatment centers, cancer treatment centers as we move along. The study describes here is really a disparity in men versus women. So in women, and excuse me, in men, age-adjusted mortality rates were 43% greater in men than women in 2020 in a 2020 study, as well as incidence of cancer rates at 19%. So this shows that men typically have lower access to screening, detection, early treatment of cancer. We have breast cancer, cervical cancer, those programs in place and set for men. For women. And we don't exactly have those kinds of same early detection treatment programs for men. So as we move forward, those are things that we need to start to develop, is those screening protocols, those prevention protocols for men. They also have those modifiable risk factors, right? More exposed to smoking and alcohol usage, obesity. Those modifiable risk factors are things that are more prevalent in men than they are women. So that's one of the disparities. The study also showed that older men, we spoke about earlier, how 65 men aged 65 and older have 117% risk, 117% increase in the cancer rates compared to men of working age, 19 to 64. And they have lower survival, worse cancer outcomes. But older patients, their tolerance to treat, their diagnosis at a later stage, also financial constraints with government insurance, and then supplemental incomes as well. Those are some of the disparities. And then a big thing that they showed in this study was in the Human Development Index, or HDI. So countries were classified as either high HDI, medium HDI, and low HDI. And in low HDI countries, we were seeing cancer rates well over 100% in terms of increase from 2020 to 2050. And in those high HDI countries, Americas, Europe, we were really seeing about a 50% increase. So that's about a 2.5-fold increase in those high HDI countries. So there's a call in this paper to expand universal health care, which is something that we've kind of played around with in terms of America. So if we can do that, if we can expand healthcare coverage for patients, that's something that's going to really help to mitigate the risk in these and the disparities between men, age, and high and low HDI countries. So how to prepare in the next 25 years? We want to proactively set up practices and protocols, especially with these specialty pharmacies, so we can get access to treatment. A lot of these treatments, they have to adhere to manufacturer and FDA guidelines. So the access to cancer treatments as well as rare cancer treatments can be readily available whenever they are determined. So health systems, like I said, we need to expand treatment facilities. We need to upgrade cancer treatment centers. and then accommodate for the growing rates in cancer for patients. We need to implement more sustainable development goals and increase the workforce capacity, like we talked about earlier. So training healthcare professionals that specialize in cancer care, qualified personnel to help manage the increased demand. And this is especially important in those low and medium HDI countries. In terms of treatment access, we want to have those good supply chain networks, develop regional networks, so we can have those essential resources to prevent shortages, ensure timely care as we go along. Collaborative practices between nurses, pharmacists, navigators, oncologists. This can help streamline the process in cancer treatment and increase the demand on healthcare systems for treatment. Policy changes as well, right? A lot of patients can't afford their treatment for rare cancers. So changing policies with insurance makers, insurance policies, so that we can expand access. We can allow these to be paid for, reduce patient costs as we go forward. Because as I said earlier, this is going to be really expensive as we go forward. So in my experience, I deal with specialty pharmacy, which is going to be extremely important as we move through the coming years, the next 25 years. Oncology is the second leading cause of death other than cardiovascular disease. And specialty pharmacy has been at the forefront. There's more and more and more novel therapies that come out year after year. Like I told you, these medications have really strict guidelines that the FDA, the manufacturers put forth. So specialty pharmacies are going to be really important as we move forward because their expertise is in gaining access to these medications and then making sure that patients stay on these medications through managing side effects, managing their adherence. So in terms of how we mitigate this, from my experience here as a specialty pharmacist, our sector of healthcare is going to be really important as we move forward. So I think that I think that we have to expand the healthcare personnel like we talked about before, but having that collaborative agreements between the specialty pharmacies, between specialty pharmacists who are involved in tailoring these medications, right? More and more expensive medications that deal with genetics, deal with targeted therapies, immunotherapies. Those are going to come out as time moves forward. And we're going to be at the forefront of helping to manage patients on these. So yeah, specialty pharmacy is going to be really important as we go forward. And oncologists are going to realize that, and they're going to start to lean on us so that they can focus on treating patients and not those clerical duties such as prior authorizations and insurance hangups and those types of things that we can help with.